Hello, it's James Gunn of Oxford West and Abingdon, Reform Party candidate. I want to talk about our health policies. First thing we must do is retain more doctors and nurses. The NHS is such a vile place to work that people are leaving the country. So, what will reform do? No doctor or nurse in a frontline role will be paying basic rate taxation. They will not start paying tax until 70%. Okay. After 10 years, their student loans will be written off if they've been working in the NHS for 10 years. Okay, then we want to make better use of the independent healthcare providers. There are not-for-profit healthcare providers as well as private healthcare. So these will provide the additional capacity the NHS needs to get the waiting lists down. Finally, in the short term, within the first 100 days, we will introduce tax relief on private healthcare. We believe that if you're not using the public healthcare, then you should have some credit back for using other capacity. So thank you for that. Right, after 100 days, we want to introduce a voucher system. So if you have not been able to get a GP appointment within 3 days, the NHS must pay for a private GP. If you've not had if you're referred to a specialist and you don't get an appointment within 3 weeks, then the NHS must pay for private treatment, a private specialist appointment. And if after 9 weeks you haven't had an NHS treatment offered, then the NHS will pay for your operation or treatment, whether it's chemo, radio, whatever, to be done privately. This is important because patients get more difficult to treat as the disease or condition advances. So early treatment is always better. And we must focus on patient outcomes and not the good of the bureaucracy of the NHS or whoever. We need to make sure A&E waiting lists become reasonable by keep promoting the original idea of reform, which is pharmacy first, GP second, A&E last. The A&E is doing fine, but the rest of the hospital is unable to take the patients out of A&E and to get the patients out into the community under social care or into a blocked bed in the rest of the hospital. So we need to get the whole thing a bit more integrated and stop people waiting for hours and even days in ambulances outside casualty. This is hopeless. Finally, we're going to have an excess deaths and vaccine harms inquiry. The MPs of the previous Parliament have behaved shamefully in this respect, except for Andrew Bridgen. People, hang your heads in shame and never show your face again in public, in my view. I'm disgusted by your indifference to 5,000 people dying every month without explanation. Thank you.